Now, a lot of people ask, well, what is preterm birth? And some people think it's just having a baby born a bit too soon and you might have a small baby. For lots of parents, it means going into labour before the baby can survive, when they go into labour at the extremes of viability. So maybe as early as 22 or 23 weeks of pregnancy. And these parents essentially have to make a decision about whether their baby should be resuscitated or not. And it's such a difficult position to be in, both as a patient and as a doctor. Globally, 15 million babies are born preterm. 1 million of those babies will die every year. It's the equivalent of a plane crash worth of babies every day of the year. The cost of preterm birth to the public sector is in the region of £2.95 billion. Now, if we could find a treatment that could delay preterm birth for just a week, it would save £1 billion for the NHS. The causes of preterm birth aren't fully understood. We know that there is a combination of things like having a weak cervix, that infection plays a big part.
We found out we were going to have a little boy and he was so active on scan. Sorry. He was somersaulting, he was perfect, and then all of a sudden I knew something was wrong, and next minute everyone's around me and all I can remember saying is, I'm only 22 in one day. When he scanned me at first, his heartbeat was still there. We knew there was nothing we could do. Someone got in touch with my husband, and I remember when he first walked through the door, I just shook my head and said, we've lost him. I just can't explain the heartache of losing a child. The emptiness that comes from losing a child is immense, because it seems when you've lost a baby, there's pregnant women everywhere, but you look at them and think, I want that bump back. I want my baby back. He was a perfectly healthy little boy, but it was my body that just couldn't carry him. I can't believe it's a year and a half since I last saw him.
So in the case of Christine and baby Katie, we were fortunate enough to understand the cause, that actually it was a weak cervix. We had the treatment of a stitch and we could get baby Katie, fortunately, not quite the way to term, but to a stage where Katie could survive, because every week in the womb counts. Rather than getting better at just treating the very tiny babies that come out, what would be so much better is if we could just prevent the problem in the first place. And so, yeah, here at the Harris Wellbeing Preterm Research Centre, with the thanks of Lord and Lady Harris and their support, we're able to do that research right now. They can have very long-term health problems, things like blindness, deafness. Some of them have bleeds on the brain which lead to very profound disabilities. Because they have poor health, they can often be hit by an infection later in life. And actually we do know that preterm birth is the second leading cause of death for children under 5. So it's not something that just stops after labour.
I'm also a member of the Wellbeing of Women Research Advisory Committee, which means that essentially I help them to decide what research to fund. Much of my working week is spent looking after patients with gynaecological cancer, of which womb cancer is the most common. Year on year there's been a rise in the incidence of womb cancer, and now, as a consequence of this, more women than ever before are dying from the disease. So there is an urgent need for new ways of preventing, screening for, diagnosing and treating womb cancer. There are very few funding committees that specifically fund womb cancer research, but Wellbeing of Women has recently funded 2 important studies that offer hope for womb cancer treatment. In the first, which was conducted here at the University of Manchester by Dr. Vinitha Sivalingam, we looked at repurposing metformin, which is a diabetes drug, for the treatment of early womb cancer. And the second, which was conducted by Dr. Sarah Martin at Barts in London, looked at using a treatment for high blood pressure for advanced womb cancer. And the data from these 2 studies has been so exciting that both studies have now made it into a clinical trial. And we hope that that will therefore improve outcomes in the future. The Wellbeing of Women Research Advisory Committee have just decided to fund 2 more research projects into gynaecological cancers. Both of these projects will focus on the early diagnosis of ovarian cancer, which is actually the most deadly gynaecological cancer. So we're really excited to see what these 2 new studies will show.